Okay, Janine, you want to go ahead and get started?
Absolutely. Hi, good evening, everyone, and welcome to our MAC chat. I'm Janine Solomon. I'm a senior attorney at MAC, and I'm filling in this evening for Julia Landau. I'm joined this evening by my longtime colleague, attorney Tim Sindelar. He's actually been a mentor to me since I started in my practice way back when I was at the Disability Law Center. And we're just really grateful that Tim could be with us here tonight. Again, the topic for this evening is the return to in-person learning. It's a little hard to believe that we're just a few days shy of when we shut down a year ago. So we'll give you kind of up-to-date information about what some of the new guidance says around in-person learning, and we'll also spend plenty of time doing Q&A. So I'll turn it back over to Lilia for a minute to tell us a few logistics.
Thank you, Janine. So welcome everyone. Thank you for joining us tonight, and welcome back to all of our chat regulars. So tonight we'll pause throughout the presentation to take your questions. We're anticipating a lot of questions tonight, so we will leave plenty of time for question breaks. You can submit your questions at any time using the Q&A button on the bottom of your screen if you're joining us on Zoom. If you're joining us on Facebook, please submit your question as a comment under the live stream. If you see someone else's question that you'd like us to answer, please give it a like. We'll also be posting polls in Zoom throughout. We have a couple polls, if you could please answer those. Keep an eye on the chat box in Zoom and the comment section on Facebook for resources that we'll share throughout the presentation as well. Thank you.
Great. Okay, let me see if I can advance. No, I can't do it that way. So I think this is our first slide. Okay, so we have a couple of slides where we're going to give you some highlights from the, again, some of the recent guidance regarding in-person learning. As many of you are probably aware, earlier this week, actually, I don't know if you had mentioned the polls, but we do have a poll that has just actually come up. So just to let people know that. I don't know if we want to let people take the poll, Joanne, before we continue on with the presentation. Okay. So
no, just keep going. No.
All right, great. So as many of you know, the elementary schools are set to return in person 5 days a week, starting Monday, April the 5th, followed by middle schools, which will be returning on Wednesday, April the 28th. High schools, they have yet to determine a date of when high schoolers will be returning, and they anticipate that details are going to be announced sometime in April. So just a few facts to know about that. There are currently still about 20% of school districts that are remote only, and nearly 80% have been either in person at this point or on a hybrid model. Again, what this plan is to return, starting with the elementary students, to return for all the students regardless of community prevalence. And this is put forth in a graduated approach. There are timelines which may have some change to them. If there are any changes that are going to happen, school districts should be giving notice to the family ahead of any plan changes so that people can obviously make any adjustments that they need to. For the in-person learning, what that, just a reminder of what that means is for elementary students, that's 5 hours of in-person instruction, and for the secondary schools, it's 5.5 hours. Related to this, there is an option for families, given the time of year, the students that have some that have dealt well with remote, others that need to remain home due to medical reasons and other concerns, there is an option for families to choose to remain remote if they want to for the remainder of this school year. School districts should be surveying the families right now to see who would be interested in remaining remote so that they can do planning. And at any point in time, even though a family has chosen remote at a given time right now, they can change. They can make a change to that and to want to send their children to school. However, the districts do need some time to plan for that, and the guidance calls for allowing a transition period upwards to maybe 4, even as long as 6 weeks, so that they can plan for that student's re-entry into school. Schools are encouraged to be live streaming of the classroom instruction for those students that are remote, as well as those that are in school. And all this counts towards the structured learning time. I don't know if there's anything else you might want to add to that intro, Tim.
Well, yeah, if I could just put this into a little bit of perspective, you know, for the last year now, we have had a lot of different guidance from the State Department of Elementary and Secondary Education. And a lot of it has been really detailed and really well thought out, but it's always been directed as a guidance that we recommend, we suggest, we do. This, for the first time, is really putting some teeth into the proposition. They are saying schools must open up. Elementary by April 5th, as the slide shows, or middle schools by April 28th, and then to be announced for the high schools. If they don't open up, schools can be punished by the state in a couple of different ways. One of them is to require them to add on hours to the school year, because this is all based upon the time and learning regulations that require set the number of hours that and days that a school must have during the school year in order to be able to legitimately grant diplomas and advance students. It also is the second way that this can be impacted is the state can withhold funding, the state Chapter 70 funding for school districts. So there's a very big stick here potentially for this. And this is just, you know, again, you know, to me, it's the first time that there has been a clear mandate from the state that you must open. I mean, we've had the state saying ever since last June, we really hope you would open. We want to encourage you to open. We'll help you to open. We'll do this, we'll do that. Now they're saying enough is enough. And I think part of it, you know, is attributable to change in political climate in the country. And the principles of the Biden administration have been unveiled over the last couple of weeks. But this is, you know, not something that's just a maybe. Now, the only part about it being a maybe is that schools can't, well, we'll cover that in the next slide. I'll wait for that.
Yeah.
Just a lead in for you.
That's right. So we'll go to the next, oops, wrong way, go to the next slide. There is a waiver process that's associated with the in-person, return to in-person learning. And it's, the commissioner may grant waivers, but it's in a very limited set of circumstances. One such example, as I mentioned before, that about 20% of the districts are still in remote instruction. And for those that can make a compelling case for doing an incremental approach, those schools may be able to ask, instead of going from remote directly to in-person, to be able to do remote to, say, hybrid instruction as a way to do it, gradually or incrementally. However, they must include a timeline and a date by which all students are going to return to school full-time this school year. So as Tim said, it's quite serious, and there are limitations, and the Desi has given a lot of specification to this. In addition, there is also a deadline by which schools need to file these waivers. So it's a very shortened time for the elementary schools, again, that are returning April 5th. their school districts would need to file a waiver by March the 22nd, so coming up just about 11 days from now. The middle schools, if they're going to request any waivers, would need to do so by April the 12th. And Desi will have 5 working days in which to respond to any waiver requests. And the school committee is not required to vote on any waiver requests. What's also different, I think, is just the coordination that's going to go on with the community providers. This is really important, those that are currently supporting the remote learning. It's really important to have these wraparound services that families have been able to access to assist with providing further education for their children and allowing some families who need to be able to return to work to be able to have that wraparound support. So schools need to be communicating as well with these community providers. A few more things. There are health and safety standards that have changed. Now the mask mandate is now for all students, all ages. And again, there still remains a medical and behavioral exception to that mask mandate, but for the first time, it's now covering all ages. The distancing requirements, it goes into detail in terms of the document that Desi released regarding 3 feet and a lot of detail about students facing forward with masks on. There are times during the day when students are eating or perhaps other reasons why there might be mask off. And if there is, students need to be 6 feet apart, there need to be windows open and so forth. So there's just an extreme amount of detail that's in there, but these are some of the newer features, as well as there's updates on transportation guidance as well. Tim, did you want to add anything to this part?
Yeah, just briefly. With regard to the health and safety requirements, I think that there's been this debate for the last 9 months probably about the minimum distance required for safety in terms of social distancing. And early on last summer, the state took the position that 3 feet would be sufficient in most school settings, when students are wearing masks and the building is properly ventilated and with those requirements met. And that was kind of contrary to the what was the opinion of many people in the scientific community, including the CDC. But that's changed over time. And was one of the interesting things about when the state announced these new requirements, they accompanied it with a letter, a very, very detailed letter from over 300 doctors and scientists, immunologists, professionals from Massachusetts, it was very impressive in terms of its strength, and so impressive that, in fact, I see in the national press that the CDC is rethinking. They're looking at studies that, you may have seen the story in the Washington Post that the studies in Massachusetts showing that schools that were implementing 3 feet as opposed to 6 feet had no difference in rates of COVID spread and or infections. So it's interesting again to see that development and see actually what the department predicted, almost a year ago, 9 months ago, is becoming an accepted standard, and actually, again, though, is very important because that extra 3 feet really makes a difference as to how many students can be in a building, this is one of the things we need to get the students into the building. And since this seems to be acceptable to the scientific community in general and the medical community, it's a way to do it. But I would, also point out that, again, we just talked about waivers, and the state has made it really clear that we don't want to see waivers saying we don't have enough room in our buildings, and and there's a very good reason for that. You know, back last May and June, the state said, look, start planning. You know, we want kids back in school. Start thinking about this. If you're going to have to get other space, look at your community for other space sources. And many school districts did not do that. Many school districts said, oh, we don't have enough room, we can't do it. And the state is now saying, being serious about this, saying that's not an acceptable excuse any longer. Find the space. It is more important for the health and safety of our kids that they be in school than not be in school. That decision seems now to have been fully made and fully embraced. And as I said before, is now going to be enforceable with a number of different mechanisms that could be used against districts.
We'll do one more slide and then we'll turn to some questions. Oops, I'm going backwards every time. This is the last, some of the information regarding the in-person learning. I think one of the things here that Desi is emphasizing is that family engagement is really critical. Desi has put out, I think at least twice now, in some of its earlier guidance, the importance of family engagement, as well as actually MAC and other members of the legal services. We really took some time to get some information together about communication plans with families, not only regarding language access, best ways to reach families. You know, some families use either text because they, you know, they can't have their phones ringing, or they're away from their phones. They're maybe not using emails, or maybe using other forms of communication. And schools really need to have that be paramount, is partnering with parents in order to support the transition back to school. For many students, some, this is their first time returning to school. And because of that, as we know, there are a lot of challenges that go along with that. Some students with autism, for example, difficulties with change in their routines. It was just as challenging when they were leaving school and turning to home for the first time. There was a lot of transition with that. It's going to be the same way, as well as students who experience a lot of anxiety. So again, Desi is recommending implementing things such as social stories, building tours, video instruction, or video introductions, I should say, with new teachers, ways to be able to ease the students back in. Districts must be communicating with parents in their primary language and providing interpreters and translators if needed. And teams really need to be taking into account the parent information. Desi actually says they have a unique insight about their child's experiences in terms of their primary needs during this time, their either ability or inability to access remote learning during this time, and any other information that the family can really share regarding ways to meet their students' needs with the reopening. Importantly, we also include here, and this has been in several guidances about school discipline. We know many students' mental health has increased and behavioral needs as well, because of a lot of the trauma that they've either experienced in their own home communities with some of the outbreaks, and just not being able to return to school. Desi has stressed not only this time around, but in past guidances about discipline being used as a last resort, and really focusing on the mental health needs of these students, trying to create these safe and supportive environments. Regular two-way communication, of course, as I said before, is just really important. And it goes without saying that IEPs need to be fully implemented, whether the student is either remote learning or in person. Did you want to add any other points, Tim, before we turn to questions?
I always have points.
Yes.
So, but you know, my editorial comments, I can't resist. But bear with me.
Yeah.
I do want to say that you know, we have seen a few good things come out of the terrible, horrible year that we've been through. And the leadership of Desi around communication with parents has really been impressive. You know, it's not just this document, as Janine mentioned, it's been almost everything. It's been a constant mantra. You know, talk to parents, be involved, make this a two-way communication. And that's such a remarkable and refreshing change from what special education law has unfortunately been too much in the past, which is do it the way we say do it. So that's really good. You know, and the guidance with regard to discipline is, again, a real great breath of fresh air. It's really wonderful. All of these things are great. You know, unfortunately, they're like many other aspects of special education law in that there really isn't active enforcement by the state. I mean, fortunately, we now have active enforcement by the state in terms of opening the buildings. But these details about communication, about discipline, about fully implementing IEPs, they're going to be left the same way that special education has always been left, and that is enforcement by parents. Enforcement through meetings, enforcement through using PRS, enforcement through using BSEA, through getting advocacy involved in that forth. So, you know, the important message here is there's some great material to work with that will make our jobs easier in terms of advocating for the students involved, but we're still going to have to do a lot of the work. I mean, this week I've seen 4 discipline cases, you know, involving comments put in the chat during Zoom meetings. It's ridiculous. Students being suspended from school for 5 days for inappropriate comments and chats. You know, that's not consistent with discipline as a last resort. You know, and the same, you know, again, I'm sure everyone participating here today can say, IEP is fully implemented, show me one. You know, we all know that that's not a reality. And we'll get to that more in the next slide. But I'm just, you know, saying we understand that this is a step forward. And it's a very positive step forward that would not have happened without the advocacy efforts of MAC and other members in the public interest law community, and some private attorneys and advocates and the Federation and a lot of people who have worked very hard to use this period of time to have a more substantial impact upon policies being set at the state level. But now we've got to make it work every day at the local level.
Absolutely. So Lilia, did you want to,
Yeah,
we have a bunch of questions in queue.
we've had a lot of questions come in, so we're going to try to get to as many as we can.
Yeah.
Our first question is, my question is from the perspective of a parent who wants their child to continue receiving services remotely. Our district has offered remote or hybrid, and we chose remote. We've received pull-out services remotely, and it's working well for our child. Will we be able to insist that services continue to be provided remotely, or can the district or state insist that we must now have our child attend in person in order to receive services?
I mean, just to start again, as we said a little bit earlier, there is a parent choice during this time period, that if families want to have their children remain remote, they have that choice. And so that's an important thing that is addressed with this recent information that has come out. So that's good for families to know.
Okay. Another part to that question, can extended school year services be provided remotely this summer under the new guidance?
So at this point, the guidance authorizes the continuation of remote services at parents' request through the end of this school year, and it's specific with regard to June. So that hasn't been answered yet. We don't know what the state might do. I think that the preference, certainly from the leadership at the state level, it would be that it not be remote, but at the same time, I think there's a realization that there's going to be such an incredible need for services this summer for a lot of different reasons that that perhaps there will be remote options available. But it's a guess. Can't tell from this guidance, at least I can't.
Yep, I agree.
Next question is, how much synchronous learning time should a kindergarten student have? I have a kindergarten student who only receives 15 minutes a week with the special education teacher. The majority of the time is for the student to do work in a binder with the parent.
I think
So,
that, yeah.
right,
Lisa.
that's on your next slide, actually.
Yeah,
I think,
that's right. And is that applicable to, I mean, I could just to be able to answer that just so people can see, and then we can turn to
Sure.
more related to it. I think this is applicable. Is that correct, Tim, to the
Yes,
question
it's
about the
K through 12.
kindergartner? Yeah. So again, it's just to be able to answer this question, and we'll provide a little bit more detail as we continue on. But there needs to be, if your child is remote learning, they need to have synchronous instruction and interaction with their teachers each day. And it's 40 hours of instruction over 10 days is the requirement.
And this is new. I mean, this requirement hasn't been in effect, I think, since the last week of January, when the emergency changes were made to time and learning regs to tighten up what had been done earlier in the year around requirements for synchronous and asynchronous instruction. But in part, this came out of, was driven, well, I think from a lot of factors, but I know one of the biggest pieces of evidence that was relied upon was the incredible toll that not being in school has had on students, and the fact that emergency rooms are flooded with students with psychiatric and behavioral challenges, that the behavioral health beds are full throughout the state, that there are long waiting lists, and that unfortunately the suicide rate is almost tripled. And so one of the things the state felt it needed to do is to make sure that a teacher was actually putting their eyes on a student at least once a school day, as the slide indicates. It's a meager attempt, but it is still at least a recognition that there is this need, that we can't just give people worksheets and expect them to be able to do that work and expect them to be able to make progress emotionally.
Did you want to give us a few more questions, Celia, before we turn back to the slides?
Sure, yeah. So just to clarify, this question was about a kindergarten student. So this applies to kindergarten.
Well, when I say that, I think that the instruction applies to K through 12, but then I think about the fact that kindergarten, actually the learning time, the time and learning regs don't apply to them. So that may not apply. And since many kindergartens are half-time, but I think that at least using, cutting that in half would at least be something that could be argued. And, the other thing is, we're talking about this as a regulation that applies to all students, general ed students, special ed students, everyone. But special education students always have the right to a free and appropriate public education. And if that means that they must have more synchronous instruction in order to get an appropriate education and make effective progress, then you have the ability to make those arguments with the school district. And if they don't do that, and you can prove that the student won't make effective progress, you can take them to mediation, you can take them to hearing, you can go to PRS. There's a number of different avenues that you can explore to try and increase the number of hours the students should be getting.
Thank you. And our helpline information is in the chat if you'd like to discuss that further with our advocates. Our next question is, will this order now require home services to be provided in person? Might have answered this already.
I was going to actually address that with the remote learning, that yes, schools are required to be considering the home and community in-person services. So that certainly, I think they have, Tim, correct me if I'm wrong, I mean, throughout, but it certainly is covered.
Yeah, I mean, but it's considered. I mean, it's not, I wouldn't say it's an order that requires that home services be provided, but it's a strong suggestion. And again,
Mhm.
FAPE is always your bottom line answer here. And that the fact that the state's saying consider it makes it even all the more a good argument in terms of FAPE if they're not providing those services. It does still remain to be a struggle. I mean, I still hear of many districts who say we will not send our personnel into homes.
Mhm.
And, I think that that's, I can't agree with the science behind what they're saying in those situations are the personnel decisions, and I think that those cases are still going to have to be fought. Many districts have consistently, ever since I worked with districts or put home services into place right away last March, and provided intensive home services for kids with autism. And I've also seen districts that walked away and provided nothing.
Mhm.
So,
Mhm. Yeah, and I think it's going to become even more, there's a concern there that as more resources are starting to be focused on the in-person and the staffing requirements that go along with that, I think it's going to be possibly challenging to implement some of the remote instruction or providing the in-home services as well, just because of the staffing needs. So again, as Lilia said, by all means, our helpline is available 5 days a week, and people should be calling us. And we really do work with families to work through questions that they have over issues that they're experiencing or their children experiencing during this time. And so we encourage you to call. Again, if your questions are either not answered tonight or as this starts to roll out, as things come up for you or your family, you should by all means give us a call.
So I've had a few people ask this question. Is the mandate to return full-time enforceable for Massachusetts students who are out of district in neighboring states?
that's a very interesting question.
Yeah.
So you're talking about students who have been placed by their school district into special education placements, say in New Hampshire or Rhode Island or Vermont. And the answer is yes, probably. But in this respect, the special education regulations make it very clear that students who are placed outside the district, no matter where it is, retain the same rights that students in general education programs have. So if a student in a general education program has a right to be in in-person instruction, then a special education student that goes to a school in New Hampshire has a right to in-person instruction. So I don't have any doubt that this can be enforced. My only doubt is, how difficult it might be to persuade people to that effect. But if I was running a school in New Hampshire, I'd sure be paying attention to this.
I know you've got some more slides to
Yeah.
get through, so I'll pause
Great.
there.
Yep. So again, just to wrap things up regarding this particular slide, anyone that is remaining remote learning, they must receive direct instruction and services. Their IEPs must be fully implemented and receive a regular and consistent schedule for each student. And once again, stressing the need for effective, ongoing two-way communication between the school and the parents. The next slide, I know it's been the topic of at least one chat or more that we have had, but we just wanted to go over again some of the COVID compensatory services, just to highlight those that these meetings, again, should be happening, and IEP meetings should be happening for all students who may need the compensatory services to address regression or lack of progress, where either IEP services were not provided or students could not access remote instruction. It's important to note that there is somewhat of a, if you're filing a complaint related to compensatory education at PRS, there is a 1-year look back period. So that's just important for people to remember that. Again, the COVID compensatory services not only cover the past school year, but also the current school year. I know some districts have, there's been some questioning around that, but the guidance, previous guidance has certainly made it clear that it's covering this current school year, and we wanted to stress that as well. What's also important is that districts continue, again, to prioritize getting the information from families. Once again, families have the knowledge, understand about their children's struggles with any accessing of remote learning, attentional issues, issues with engagement during this time, any increases in behaviors, regression of skills, and just any overall impact that many families and many communities may have experienced due to COVID-19. One other thing to stress, and I don't know, Lily, if you put this in the chat, but one particular group to talk about is those that have turned 22 during the pandemic. I just wanted to point out that one of Mac's legislative priorities this session is a bill which would address the needs of students who have turned 22 during the pandemic and who require compensatory services to address any regression or lack of progress. What this legislation would do would actually would be amending the circuit breaker funding, which would allow for reimbursement of costs associated with providing compensatory services for students turning 22. We have a fact sheet, which I think might be posted tonight. If not, certainly we often put out a lot of social media posts, and it's certainly on our website about the various pieces of legislation, including this one that we support. And we certainly will keep people updated with alerts regarding any developments that are happening on these bills. Did you want to add anything at this point on Comp Ed, Tim?
No, I think that you've covered it. Thank you.
Yeah, great. We have two more slides left. This just really is important to us at Mac, and I know for Tim and many of us that practice in special ed, of just the really high disproportional impact on Black and Latinx students. Not only were students of color disproportionately impacted in terms of suspension rates, in terms of placement in segregated settings, but things have really been compounded during this time. As I said, many of the students are living in communities that have just been devastated by the virus, has completely impacted their families and surrounding communities. Many of these students are, again, living in communities that have only been remote instruction up until this point. They haven't had the access to either the computers or the internet access that they need. And the concern is just that disparities are actually going to increase. Same way, as I said, with students that, pre-COVID were already in more segregated settings than their white counterparts. There's a real concern that, again, students coming back, students that may have more behavioral challenges, regression, dysregulation, we have a concern about even more disparities increasing this. Same way with discipline, as we mentioned before. The rates have always been higher for Black students, particularly Black boys, as well as Latinx students compared to their white counterparts with disabilities. So this is something that we're keeping a very strong eye on, and we just wanted to be able to cover it because of its importance. And there is one more slide that actually, Tim, I will let you take over.
Okay.
To tell folks about.
Sure. I thought we should just mention breaking news, and many of you may have seen this on your news tonight or read it in the paper over the last couple of days, but the American Rescue Plan has passed Congress, has been signed, and the really good news for us is that it contains a great deal of money for education funding. There's $170 billion that's dedicated to education funding. Now, some of that is for higher education. I think maybe 40 billion of that, but there's well over $100 billion that will be distributed to the states, be distributed to school districts. And it can be used for a lot of different reasons. It can be used to hire more teachers to reduce class sizes. It can be used to modify spaces. It can be used to modernize the ventilation systems. It can be used to hire more custodians, more nurses, more counselors. It can be used to add supports to address the student trauma and the loss of learning that's occurred over the last year, to update mental health services, to support students' emotional well-being. And again, the state has been stepping forward with guidance on these particular issues and, suggesting the need to be for districts to be planning and providing these supports, and many of them are stepping up. There's also, part of the bill was prioritization of teachers for vaccine, and we're seeing that happen now with teachers to be vaccinated in pharmacies throughout the country, throughout the state, beginning this weekend. There is some money that's specifically set aside to address the equity issues, a challenge grant to support partnerships with community groups and other organizations to address the equity issues that Janine just mentioned. And there is a $7 billion fund to purchase technology to resolve some of those disparities that we saw over the last year in terms of access to technology. So it's a great, but what it is also is this challenge to us all to make sure that with this new source of funding, that we don't just continue doing business as we've been doing business, that we take advantage of this opportunity when we restart and return to school buildings with some additional help from the federal government to address the equity challenges, to address some of the really major substantive challenges in the educational system, and particularly in special education. And what this means to me is that all of us need to step forward now and say, we've got to work with our districts to make sure that, again, this isn't just spent the same old way. It isn't just money thrown away, that we walk away from this opportunity to do something different that's been created by this earth-shaking episode. So it means PACs, SPED PACs need to be meeting and talking and meeting with the special education directors and meeting with the school superintendents. We need, much more active involvement in our school committees to make sure that they're making appropriate decisions with regard to planning for the return to school, the spending of this money, and redesigning education so that it benefits all students. So, we could go on all night on that, but I think we've run out of most of our time, but we're willing to stick around here to try and answer some more of these questions.
Yeah, that's right. We'll stay on till 9 o'clock to answer questions. So I'll turn it back over to Lilia, but thank you for that, Tim. That was extremely important. And as you said, recent late breaking news. So good way to end.
Thank you both. Let's get right into it. First question is, will Desi do anything to hold districts accountable for compensatory services? My district has currently pushed off these conversations because my child opted out of remote learning. So they told me it would be typical to assess after 6 weeks of in-person learning. He started very limited in-person learning on February 1st and starts full school days, 4 days a week next week. I'm wary that they'll try to offer standard extended school year in lieu of true compensatory services. So will Desi do anything to hold districts accountable for compensatory services?
The answer is difficult. It's still we're still in the early stages of this process. One thing that is clear, though, is that Desi will enforce compliance, at least procedurally. So if the school district refuses to address the issue of compensatory services, or won't do it in a meeting in which the parent could be a full active participant, PRS is a good remedy. Already they've issued some decisions around the procedural aspects of addressing compensatory services. The more difficult challenges lie in the substance, as you've pointed out. And, we've seen quite a few school districts already suggest we're going to do compensatory this way. It's going to be summer. That's it. It's outlined. I think Boston Public Schools has essentially said that in its policy, as well as many other school districts are saying that in a less formal sense. And I've seen at team meetings, a lot of teams come fully prepared to discuss the issue of compensatory services because they have a script. And the script is, we've decided that there really isn't been any regression. They won't talk about the lack of effective progress, which is part of the equation to determine compensatory services. And there will be disagreements. Will Desi step in and do anything? No, I think the Desi will do the same thing that happens mostly with special education. This is a parent-driven, enforcement, student by student, through the due process procedure, the procedures that are available. I don't think it will be any different. And partly because Desi probably lacks the resources to be able to do anything effective. They've tried to give guidance. We've got a pretty comprehensive document, that cites what should be considered. That document was developed with input from a lot of different stakeholders, including people from MAC and people from the public interest community, but it's not perfect. And again, it's guidance. I do know that some of the hearing officers at the BSCA are very interested to hear these cases and will want to, but as with almost everything at the BSCA, the time and expense of getting through a hearing will make the hearing process an ineffective remedy to obtain compensatory services. My best advice to you, if you're dealing with compensatory services, is to have a clear plan of your own as to what you think is appropriate. The more that you can come in with a clear articulation, not just I'm mad, we lost 37 hours of speech language, but a question of how that can best be addressed. And it's going to be difficult. Compensatory is always difficult because how do you add to a student's day? How do you add to the school year? How do you find time to deliver these supports? But if you think through that process and you have propositions, you're going to be much more effective. The other thing I would recommend with regard to compensatory is the same thing that we all recommend anytime that you're anticipating a dispute with the school district about services for your child, and that is find some backup. Get a professional to say, there's been regression, or there's been a lack of progress, or this is what's going to be needed to get the student back into the position they should have been if services have been delivered during the school year, which should be the standard for compensatory. And that's, again, easier said than done, but there are a lot of places, a lot of resources you can go to if your child's in any kind of therapy, receiving counseling, if your child sees an outside BCBA, the child's pediatrician is a source. There are a lot of places you can talk to professionals to get letters of support so that when you come to the team meeting to discuss compensatory services, you're armed and ready to go at it.
Exactly. Same way with, document for families to be able to keep track of what's happening on a day-to-day basis of the home.
Right.
So, very sage advice. Do you have any next question for us, Lilia?
We also have a remote education log that parents can use, which I'll put a link to in the chat in a minute.
That's great.
Absolutely. It's a great thing.
Next question is, Commissioner Riley wanted all kids on IEPs in school 5 full days a week many months ago. Why were only the very highest needs children brought back for 5 days a week? And why now are kids on IEPs not being prioritized for a full return even before the official start dates of April 5th for elementary?
I don't know that any of us can answer that because we're not the commissioner, we're not on the Board of Education, and it's not done the way that any of us here, I think, would have liked. I can only suggest this. We have experienced, the greatest time of uncertainty that I've ever known in my life, and maybe some other people have a different experience, but it's been essentially a time when what is reality one week becomes not the reality the next week, and it's constantly shifting. It was pretty clear that when the state developed the return to school guidances last May and June, that they really anticipated all students being back in school in the fall. And no one anticipated the surges that happened over the summer, the surges that happened in the fall, the surges that continued in December. And I think that part of that, contributed to the problems. Everything that the state has issued, as I said earlier, up until this point has been guidances rather than directives. And the notion about prioritizing students, again, it was seen as a way of recognizing that it's difficult to mandate this on a statewide basis, that every district is going to be different, that in fact, communities across the state were different with regard to the rate of infection and the danger of being in school. And again, and it was just a guideline that, you prioritize these students first, and then you get to the others. And I think that the time that the prioritization was developed, again, the notion was we'll get these kids back in school, and a month later we'll get other students on IEPs back in school, and everything will be fine. And what we found is that we're now 7 months later, and that hasn't happened. And partly it hasn't happened because of unexpected changes in the infection rate. Partly it hasn't happened for other political reasons. There are too much to go into here today, but what we can't do is dwell on the mistakes of the past. We can just use them to inform us going forward in our advocacy work to make sure that we don't have these problems, especially on the local level. And that's the other big issue here. I mean, I think that this has been a major learning lesson for all of us, that, we have, these 350 some school districts throughout the state that do retain a great deal of local control, that we have very limited state control over education. And perhaps that is going to need to change at some point in the future, because we found that this local control, whereas sometimes it can be really helpful, has actually been very dangerous to many of the children that we work with.
Well said. I think we have time for one or two more questions, Lilia.
Next question is, what are the mandates for doing testing evaluations for students with disabilities?
Does this refer to Mcas or the evaluation process? Do we know?
It sounds to me like the evaluation process, special education evaluation. But if this person is here, if you can put that in the Q&A.
Well, just briefly on the evaluation process, again, the state has been clear, the federal government's been clear, everybody's been clear. There's been no waiver of timelines. There's been no waiver of the requirements to do assessments. You have to do them. And, again, how that gets enforced is another question, but, and at this point in time, it should not be an issue any longer. If it is, please let MAC know, because they would want to address that. We'd all want to address that.
Call our helpline.
Yes.
Next question is, how do we handle students who are remote, but some services may want to be delivered in person? It doesn't seem like there's a lot of wiggle room here.
Yeah, I don't have an answer to that. I mean, it seems that the state has essentially said, you must provide a remote option, and has allowed school districts to put some limitations on that. For example, if families want to move from remote to in-person or in-person to remote, back when that was possible. the school districts sometimes put serious time limitations on being able to exercise that. And the state discouraged that, but, didn't limit it, didn't take any affirmative action to prevent that from happening. But again, if we're talking about students with disabilities, there's always FAPE, there's always 504. And, if the student is in remote but needs to do in-person speech therapy because that's the only effective way, then the school is going to have to make an accommodation, a change to their policy that they only do remote, if you select remote, if that's what's necessary to get the student FAPE.
Maybe one more question. Looks like we have a few more minutes left.
So what are the health and safety requirements for transportation? I have several clients who are traveling to out of district placements for a long time, at least an hour. Will there be limits to how many people will be on transportation? For example, the monitors, the driver, and students, their requirements around that.
Yeah, there's an extensive guide to transportation. It's got pictures in it as to how many, for different kinds of vehicles and how many seats can be occupied. I don't have it memorized. All I can tell you, it's on the Desi website, and it's very detailed.
Mm-hmm. Tim, did I understand, not related to maybe the longer distance, but for some of the other school buses where they may go back to more capacity on those buses now that kids are going back to in person?
It makes sense, but I haven't seen that they've revised their guidances yet.
Okay,
But,
right.
I wouldn't be surprised that there is something that comes out soon.
Yeah.
I just found something that was updated February 11th. So,
okay. Good.
Great.
It's a Word document, so I can't send that now, but if you contact our helpline, we can get that to you. All right, we have time for one more question. Any idea how Mcas will work for remote students? The child lives with high-risk family members.
The state's made it clear over and over again that the only way Mcas can be administered is in buildings. So, you probably have seen that the Mcas has been delayed. It will be in May and June for all students. There's a different date for administration for K through 8, and then for the high school Mcas. But all of them are in May and June. And they're abbreviated. They're cut down. They're going to be shorter. But they haven't figured out, and I don't think that they're anticipating trying to figure out some kind of remote administration because of the security problems with regard to the Mcas.
Okay.
Okay.
We've got a lot, and I'll put the helpline information in one more time if we're not able to get to your question. I have a question about the synchronous instruction model under this new guidance. For remote students, are they just going to be zooming into a classroom? How is this better than having the individual one-on-one Zoom time that many remote students were having?
Well, first of all, it's not a requirement that necessarily would change. The state does favor that, and a number of school districts have gone into this model where the remote students are getting live streaming from the classrooms, and the state has pushed it. It's been put out there as a model in a number of meetings, and the school districts are doing it, have received a lot of publicity. I can't tell you. I mean, I'm not a teacher myself, why it's better or not, but it seems to be accepted by the state as being a good product. But you're right, it probably wouldn't match if it was one-to-one, but I don't know that there are that many students that are receiving the benefit of one-to-one Zoom instruction that I know of.
We just at about time. Yeah. No, this is wonderful, and thank you so much, Tim, for joining us tonight. It's you are.
It's a pleasure. It's great to work with the people I've known for so many years who do such good work. Really, I can't say enough about MAC and what it's done for our community. So. So, and Janine and Joanne. So
Yeah.
it's been wonderful. Thank you.
Thank you.
Thanks
Thank
so
you
much,
very
Janine.
much. And as Lilia said, we have resources available that will be in the chat, as well as our phone number for our helpline. So please keep the calls coming. It really helps us to stay informed about what's happening all across the state. We wish everyone a good evening and a good transition back into school. So thank you very much for joining us, and we'll be back. Is it in a few weeks, Joanne, or is it in
It's once a month, so next
once a
month.
month? And
Yep.
once a month, and we'll be
Yep.
sending out information about the next chat soon. So take care, everyone.
Absolutely.
Bye,
Yep,
everybody.
we are the second Thursday of each month now. Before we go, I just want to put in a little plug for our virtual 5K, the Run, Walk, and Roll to Equity. I put the information in the chat. It's a virtual 5K fundraiser for MAC. So please, if you can, visit our event website. You can go to massadvocates.org/events to sign up. You can run, walk, or roll right from home and have a chance to win a free t-shirt and support our work, including these chats. So thank you.
You.
Thank you, everybody. Bye.
Bye. Okay.